What's up, guys? Dr. Brooks, Des Moines Spine and Sport, another Movement Monday video. Over the past few weeks, we've been talking about basically dysfunction that we commonly see associated with our patients with low back pain. We started with a number of videos that are focused on hip mobility or strategies to improve hip mobility, and then we transitioned for the last few weeks to some stability, specifically abdominal stability pieces. This week here and the next couple of weeks, we're going to transition to some T-spine mobilization strategies. But I want to kind of take a look at the spine here and walk you and talk you through a little bit of the concept here with regards to that. So the spine in a good functional position is made up of three basically curvatures, and put together they make up kind of a modified S curvature. So in the lumbar spine, the low back, we've got a reverse C-shaped curvature known as a lordosis. Through the mid-back, the thoracic spine, we have a C-shaped curvature, a kyphosis, and then in the cervical spine, the neck, we have another lordosis. So our spine's a little bit beat up here from demonstrations, but you get the general idea with reverse C, C, and then reverse C again. What we'll often see with our patients that are experiencing low back pain is those patients will have a lot of difficulty extending through the T-spine, or they'll potentially be stuck in a flex position. A lot of times this is due to just the fact that most of us work at a seated position. You know, we're in front of a computer, at a desk, those types of things. So we'll get stuck in this flex position. What that'll inherently force us to do is find extension somewhere else. And a lot of times we'll find that extension through the low back. So because we're flexed through the T-spine, we'll end up extending then through the low back, that lumbar spine, which causes basically like a hinging effect, or we'll create hinging points or points of compression or pinching. And what we'll typically find is with some of that extension or that hyperextension, that low back, we'll get pain that'll manifest due to basically some facet impingement through that lumbar spine. So what we're going to do here today is basically give you a couple of strategies to induce some appropriate thoracic spine extension so we can avoid having to extend at that low back. So we're going to start here with a smashing technique and transition to a dynamic stretching technique to induce some of that thoracic spine extension. So what we're going to use is this foam roller here, and I'm going to go through what we use in the clinic, or what we call in the clinic is basically a fulcrum T-spine extension exercise. Okay, so we'll transition to the ground here, and what we'll do is we'll basically make our way to a seated position here, and what I'm going to do is basically place that foam roller right at the bottom of my rib cage or the bottom of my T-spine. That's going to be my starting position. And what I'm going to think about doing is basically using that foam roller as a fulcrum point and extending over that foam roller to induce some segmental extension of that T-spine. Usually what we recommend patients to do is to do about 2 to 3 repetitions per spot, and then to really focus on not globally extending, but letting yourself be guided down, basically guide yourself down by your chin to come into extension while still keeping that neutral spinal position. So I'll make 2 to 3 repetitions at, say, the first spot. I'll basically transition that foam roller up, say, about 1 inch, and then I'm going to make my 2 to 3 repetitions again, letting my chin guide myself down, maintaining a good neutral spinal position throughout. All right, so we just smashed the T-spine utilizing our foam roller fulcrum strategy, and we're now going to transition to a dynamic stretch. Okay, we want to elongate some of those tissues that are potentially pulling us into flexion or keeping us from extending appropriately through that mid-back. For that, we're going to utilize what I call as a kneeling pull-through. I'm going to use here a box that's roughly 24 inches high. The side of your bed, the back of a couch, even the wall from a standing position works really great for that. But what we'll do is transition down here to the floor. I'm going to get into a kneeling position and have my wrists basically at the very edge of that box. And what I'm going to do is I'm going to pull my head and chest through my shoulders to open up and force extension at that mid-back. And then I'm going to pull myself up to a neutral position, or excuse me, a flex position, and then pull back down into extension. What I want to focus here is, once again, maintaining extension through that T-spine and avoiding hyperextending at that low back. So keeping a neutral lumbar spine, neutral low back, pull that head and chest through the shoulders. So that wraps up our T-spine extension series. Take a peek and look out for our video coming next week where we'll outline a couple strategies for inducing some thoracic spine rotation.